Welcome to the clinic again.
Doc, good to see you again.
Thank you.
Yeah, today we get the pleasure of talking about something that concerns a lot of people. And what is that, Doc?
Thyroid function, and in particular Hashimoto's, just having your thyroid collapse after 40, particularly affecting women, and I feel really bad. However, I've seen some incredible results, and with red light therapy and photobiomodulation, I'd like to share with you.
Absolutely. Well, let's go ahead and dig right into that. Obviously, with respects to the thyroid, there's still a lot of studies that are being done. But what do you find in red light that tends to help in that regard?
Okay, so first of all, I have to start off. This is for your consideration and you and your healthcare provider's consideration. And therefore, I'm sharing with you certain information. And shortly afterward, I'm going to give some testimonials now, and then we'll talk about what the research shows. Okay?
All right.
And then we'll talk about the product next.
Excellent.
There you
Excellent.
go. All right.
Well, let's dig right into it.
It's so hard after 40 for all of us, especially in this stressful environment. I'm a clinician. Um, Even though I'm a doctor of chiropractic, I see people for very difficult things, backlash, whiplash, pain, and the bed is a whole body approach. We have these pads and we got a mask, right? We got your mask here, and we want to show you that. But one of the things I've saw, this was about a year and a half ago, was there was a lady that I was treating for a car accident case. Okay, so I'm doing my laser and my red light therapy with her, and she had this huge goiter, just incredible. It was noticeable, right? Noticeable. Just like there's a bow tie here, imagine this big swelling. And in 3 months, when we were done with her care, and she was on her way, she had, right before she had been released from care, she had gone to see her practitioner, her doctor, right? And her doctor was like, where'd your goiter go? So even with this gentle approach, her goiter in 3 months had shrunken so much that her doctor had noticed immediately, and said, "What are you doing?" Okay, and so that is something that I've kept in my heart, and I would like to share. Um, I my scope of practice as a chiropractic physician or a doctor or whatever you call it. Um, it doesn't include thyroid dysfunction. However, my thing is musculoskeletal pain and function. I want to, if you invest in our services, red light therapy services, you want to see an improvement in function. And that is what I'm sharing with you. I've seen it several times. I had a nurse come through for several months, and she reduced. We're going to hear about the results here shortly.
Okay. Excellent.
Yeah.
Excellent. Yeah, it's amazing, and that's a really cool thing that I love about being in this industry of red light therapy is it continues to impress when it comes to the things that it can help with, and that's just I look forward to even seeing more as we continue on. But you definitely have me interested in this hearing this testimonial. So
Okay.
let's hear it.
So
man.
let's do chapter 2. Let's do chapter 2, the results. Okay. And so this is just, again, I'm an AI guy. I really like it a lot. It has historically been called something low-level light therapy. Just ignore that, okay? Um, but it is a non-invasive therapy for chronic autoimmune thyroid dysfunction, okay? Also known as thyroid Hashimoto's, okay? However you want to pronounce that. And then rather than just treating the symptoms, it gets to the underlying reason you might have this dysfunction, whether it be age or stress or diet or fitness, okay? But the first thing and this is the thing that I saw, is that it reduced the amount of need for medication.
Mm.
And that is incredible. That right there. And I saw that with a nurse, okay? She was like, how do I work through this? Because now I don't need it anymore. And that's actually the last sentence is the regenerative potential, even after a 6-year long-term follow-up, some of these folks just didn't need it anymore. They didn't need their medication anymore. And that is regenerative physical medicine, folks.
Yeah.
That's the
That's
thing.
impressive.
Yeah.
That's impressive.
That's,
Yeah.
you're creating a healthier you. You're investing. Your investment is creating something that is going to last even 6 years later.
Yeah. So
Okay.
when it comes to that, I presume, obviously everyone's body is different. So in that scenario, obviously, uh, you mentioned red light therapies being just utilized not as a solve all, but as an option to do something ininvasive.
Yep.
And with
Without
respects
side effects.
with respects to that, uh, though everybody's bodies are different. Uh, wouldn't you say if you're dealing with those thyroid problems, you'd at least want to give it a try?
There's so many conditions that I've seen it benefit. This is just one today. We're focusing on thyroid. But yes, you don't just give it a try. Stick with it because you're creating a healthier you.
Yeah.
It's I'm 61 years old. I'm not exactly bulletproof, but everybody in my age, they got, medications and this and that, and they don't heal, and pain, and I don't have none of that. None of it. Not because I do it, excessively, but because I stick with it.
Yeah.
And let's talk about the next one.
Sure.
Downregulation of thyroid antibodies. Okay. So oftentimes you'll hear in medicine, well, there's an autoimmune response. And we don't really have any way of helping that except for to suppress your immune system. Okay. And so this is a way to what I call, again, and it says here, modulate the immunoregulation response. So therefore, it's making your body healthier. And back to what's the goal? Your goal is to make your body heal itself. Your body is to restore function. Your investment that you're putting into these time, and it's not much time. It's not much investment compared to having thyroid medications or having your nodules burned off and whatever. If we can help that, okay. Again, I believe the miracle is that we can help many people not have that come about. Okay, improvement of your vascularization. They see that the thyroid becomes healthier, and now we talk about the dose, right? Decrease. Oh well, let's go back up. Decrease oxidative stress, and that's the secret of red light therapy. Decreases the oxidative stress by restoring the energy system and improving microcirculation and then stem cells and everything else. And then all of a sudden, things start working again. And you get past it. Maybe you can prevent it. Maybe you can slow the progression. Maybe you can reduce your medication to maybe zero, which is I've seen, I think. And so, but the important thing here at the end, we're just talking about the research rate, okay? Before we go into looking at how this works, is that it doesn't have to be real strong. The face, the neck, doesn't have to be. I mean, if this guy hurt his shoulder real bad or his knee, God bless him. Look, he doesn't even have anything. That's really incredible. We want a spot treater that can focus more. Okay,
Yeah.
but when we're doing the head and above, we don't want that intensity. We want this gentle bathing.
Yeah, it doesn't have to go deep.
No,
Yeah.
it's right there. The thyroid's right there, right after Adam's apple. It's like looks like a bow tie. Okay, all right. So it's definitely there, and there's the references. And again, I shared my clinical experience. I wish I could help more people. I wish I could talk about it more, but it's just something I see that people get benefited from in the therapies I do, and I'm glad we can talk about it. So what's the next thing is what does a red light therapy look like if it's on your face?
Right. Well, hey, let's solve that problem right now.
Okay, so I'm going to introduce while he gets us started. So these are chips, okay? The spot treater is more of a strong LED. And then the lasers are big diodes. But these are chips, and these are miracles. The fact that these things even come about today, I mean, we are so lucky. I mean, 5 years ago, did you ever hear about red light therapy? No, you were talking about supplements. You were talking about, which is not I believe in nutrition, trust me. But we have the face mask option. you know. And this is a nice one.
You know,
It has little straps. We're not going to put the straps on here now because we're not at home and relaxing. But more importantly, it has this little guy right here. So, in addition to the face, we have something that goes around the neck. Okay. Now, if you're if you're if you're just doing prevention, okay, or if you're if you're considering treating thyroid uh, ups and downs, um, just take it easy for a while. Okay, you don't have to go 30-40 minutes. Okay, just because this thing is right on the skin, it's strapped in here while you're doing your mask, while you're chilling out. uh, uh, I would say at the most maybe 5, maybe 10 minutes. These little chips are able to provide the dose with the right wavelengths. And if you're really super sensitive, you take your time. Okay, you got to allow your body the ability to get its strength
yeah,
up,
yeah,
and support it with nutrition.
yeah. I usually recommend with this 10 minutes. With respects to the
Yeah.
face mask, like you said, it doesn't take a lot. So 10 minutes before bed, maybe 10 minutes in the morning, whatever's more convenient for you, as a way to begin your day or end your day.
Yeah. Begin your day.
And it's
Yeah.
refreshing. The good thing about red light therapy, it also shows that it promotes and gets your body. If you're wanting to go rest well and have a good night's sleep, it promotes that.
Mm-hmm.
If you're wanting to use it in the morning, it's also good to get your body prepared for what your body's about to go through for the day. So either end of the spectrum, it's balanced and it works. But yeah, like Doc said, 10 minutes is really about all it takes.
Yeah.
You can adjust it to a little bit more if you want to, but as we've mentioned, everybody's body is different. So you want to start off small and adjust as you feel your body would like.
Yeah. And there's okay. So let's the next thing, how to use it. Um, Safe. Well, it's very safe. I don't see um, there. If you have some serious issues, just consider have someone of an expert grade help you understand how to but use it wisely. Um, but let's go back to when to use it. Yeah, how many people are at 6 o'clock in the morning up in the gym? Yeah, there you go. You're laying in bed, you're doing your stretches. Just lay this guy on here and just take that 5 or 10 minutes to restore the function of your body's ability. It regulates the adrenaline. It regulates they got all these, functional medicine talks about the adrenal cortex and all that stuff. Um, but it's so simple. Your body takes care of itself. So if a great time to use it is in the morning, if you're going to be working out, get warmed up, so to speak, restore, and even your face. Think about when you're working out. Just how if you have this so distressed, and then of course you hit your, my shoulder or my hip. We got to talk more about the left hip. That's the one you target with the deep treater, okay, and the knee, whatever, okay. Um, but this is a great way to get things functioning for the day, and the investment is just a couple minutes of your time. And if you aren't doing it, the cost is pretty significant. I mean, uh, as again I said, a lot of these ladies that I've met in their 40s, particularly back at campus, are just and they're 40 and they're athletes. These are not people that are sedentary or anything. These are people that work really hard, are very fit, do a lot of fit, and their thyroid is just suffering. And so this is a great way to very, I believe, easily prevent or slow the progression. But if you do have, and I hate to use the cancer word, okay, so let's do the last chapter. If you do have cancer of the thyroid, okay, you're going to have some serious treatments, and but even so, um, this can help. It's reduce the severity of the side effects.
Mm-hmm.
Okay, and again, even though you're doing it here, when you're done here, just lay it on your chest for a while. Get some tummy time or chest time, to reduce the severity. But more importantly, um, with as soon as you're clear, there I don't see any research out there showing that it creates worsening of cancer. It seems to always do the opposite, which is the darndest thing. Okay, even though there's better circulation and stuff like that, it's really has. But I can't. I hate to give you a false lead because I do care about everybody, and I do care about you. Okay, but just do tummy time, do your face, and to reduce the symptoms here, learn some gentle massage, how to get it down, and but I don't know any other real. That's the only one I'd be worried about, to be honest. I don't. That's other than that, enjoy.
Yeah.
Get that thyroid working.
Yeah.
Get us
Yeah.
get us more energy. Look at us. Look at us. I mean, we're bouncing off the walls. We can't wait to make these videos.
Yeah, it's a highlight of my week every week, that's for sure. So, but I appreciate you giving us that insight. I think for everybody that's been listening in today, hopefully that's helped you realize that there are options out there for you if you suffer from those kind of things.
Yeah, thyroid dysfunction.
And hopefully we can be of assistance in that regard. And we'll continue to talk to you about even more topics. But if you have any questions, feel free to reach out to Dr. Eric Bunge or myself at Red Paw.
Yeah, Red Paw.
And
This is the Red Paw Podcast. We're here for Red Paw. We want people to understand. Okay, last part. What is Red Paw? Red Paw is there to help people have really good red light therapy.
Yeah, 100%.
Okay? And in a way that they can do it in a way that enjoy it at home, or helping other people. I mean, if perhaps you're a massage therapist or you're a fitness instructor, and boy, you notice a trigger point, you want to get that, you want that spot treater, and just it doesn't take but 3-4 minutes. I mean, and you can be talking to them and maybe doing some manual therapy if that's what you do as well, while you got it here, and then work on the neck and then switch them. So Red Paw is here to help us, me myself too, because getting ready for these videos, I do some new homework, not that I haven't researched it before, but it gives me a chance to upgrade or update on the research.
Yeah.
And it is there. And Red Paw it's there to help, whether you're, what do we call it, practitioner, or a clinician or a therapist or a fitness instructor. Red Paw is there to help you have something that you can rely on, that's portable, and see benefit pretty much immediately.
Yeah.
But I wanted to, last thing, it doesn't happen in one visit.
Isn't that the truth?
You see people 2 or 3 times a week for training, okay? To get the training effect, especially if they're, older, this stuff, minimum 6 visits. I was just working on this on my own protocols, and my advice is you got to give it a good 6. Then you'll see. And if it convinced you that it's working, if you felt the difference, if you can see how it's changed your complexion or your energy levels, okay, or I guess feel your energy levels. These are the things that this is a really good commitment to your well-being, and the investment is well, I don't know. So the investment is worth it. That's it.
100%.
If you ask me.
Well,
So Nate, thank you.
Yeah, thank you very much, Doc. I appreciate it. And until next time on Red Paw, where we'll have more ways that you can utilize red light therapy to your advantage. And hopefully Doc and I will continue to give you things that you can learn from to better your life. So next time on Red Paw, we'll see you soon.
Thank you.